My name is Heun. I'm a consultant psychiatrist, and today I would like to talk about acute stress reaction. Many people might have seen this. I've seen it when I was coming to an accident, and so odd behavior of people shouting and running around and risking themselves running in front of other cars. Essentially, it's a transient disorder which lasts a few hours or maybe days, but usually is short-lived for maybe an hour. People are behaving oddly in case of exceptional stress. As I said, it could be a major car accident, it could be an assault, it could be warfare, it could be rape, it could be a fire or any other catastrophe. And any other severe event. Usually this event is providing lots of anxiety and a threat to the security and physical integrity of the individual or of a loved one. So it could be a loss of a child or loss of someone in an accident. And usually the symptoms can be quite mixed. It can be agitation, it can be anger, it can be despair, it can be severe social withdrawal. People might be like stuporous, not reacting or overreacting, excessive grief, crying, and other forms of unusual temporary behavior. Usually, many people have experienced some events like this, and people would say in a lifetime it's about 10 to 20% of the people who have experienced some acute stress reaction. Sometimes when this acute stress reactions stays for longer and the trauma or the threat stays for longer, it can be developed into a PTSD, so that a loss of a child, a loss of a family, or severe changes in the physical integrity or loss of a limb might lead to PTSD. But that's another thing. Usually the management is simple: to keep the person safe, make sure that there's no other threats, to in addition to what happened already, just support keeping people warm, keeping them socially in a safe environment. And usually when the stress is involved, the symptoms resolve usually. If the stress continues or the consequences of the stress continues, symptoms can stay for longer. And I said there could be development of severe depression or PTSD if there's a long-standing trauma. But usually these short-term acute stress reactions, they wane after a short time, and they're very often seen and can be very dramatic, but reassurance and staying and giving some security and safety might be enough for many people. There's a discussion about debriefing, but we come to this in another occasion. Right, thanks a lot, thanks for your interest, and I hope you might subscribe to our channel, Global Psychiatry Archives. Thank you.